Hello everyone, my name is Julia from Kenya. Kenya is a country in East Africa with a population of 48.5 million people. So I've been requested to speak about Kenya's innovation under the Joint Health Inspection Framework. Now in 2015, Kenya, with the help of World Bank and USAID and both private and public stakeholders in health, came together and designed an inspection checklist, which was meant to grade all hospitals in the country and bring out their scope of services. So together in 2015, this was launched and it was developed with its guidelines. So in 2016, a joint team was formulated. Remember, the joint inspection checklist can be used by a joint team or can be used singularly by an entity or an institution or an organization that is interested in knowing the level and the scope of services of a particular healthcare provider. So a joint team was formed that comprised of representation from Ministry of Health, representation from health regulatory bodies in Kenya, all of them, representation from the National Hospital Insurance Fund, and representation from the county governments. Remember, Kenya has a devolved system of governance. Therefore, having 47 counties, we technically have 47 governments, and each county has its own Ministry of Health, which looks into matters that concern health, human resource, health service delivery, and all hospitals under them. So this team went around in 2016 and assessed all healthcare providers in the country. Now, it's noteworthy that this checklist takes into consideration several dimensions, including administration, facility profiling, medical and dental services, health management information systems, patient safety. It also looks at products in medicines and healthcare. And finally, it grades you based on scores. For example, a score of below 10%, you are a very high risk facility and you face prosecution and closure. If you score, for example, above 75%, you are a compliant facility and you are exempted from inspection for about 2 years. If you are about between 40 to 60%, you are given your warnings and you are inspected again in 6 months. So the Joint Health Inspection Checklist is a good checklist that brought together both public and private partnerships and gave us very good outcomes, the results of which are still being implemented by the National Hospital Insurance Fund. So we recommend joint health inspection in your countries. And so I want to say thank you to JLN and